Hey guys, welcome to Podiatry Practice Mastery. Don's here. I'm going to talk about day number 2 in the shockwave course here in Boston. This was a good day. Day number 2 is only a half day, and so I wanted to share a little bit about what the experience was. This was more about practice management, and really when you're coming to any of these types of events, I think the practice management is the best part. Had some great speakers. Those that follow Chris Milkey, he is a podiatrist, he talked, and then some of the other podiatrists as well gave some ideas. There were some other specialists as well. There's a local guy here in Massachusetts that I want to go visit his practice as well. So what are the kind of the takeaways or the general impressions going through the Experience Transformer? What worked, kind of what didn't work, and what would I do differently? So what worked is it was great to see how other people are using shockwave in their private practices. Especially they really explain how anyone can use it, especially if they're just starting out with just the radial device, and then adding the focus device, and then adding to the EMTT. And then they were also talking about low-level laser or laser therapy. And so the big takeaway, the big thing I learned is I do have a couple of lasers. I have a Remy laser, and I have a Cutera as well. And I have a lunula. And so I have a lot of lasers. The main one I use the Cutera for is for warts, and I think it does work well. The lunula I use for nails. I don't think it works all that well, so I don't use it that much. And the Remy I don't use really at all because it's in my other office where I'm only there once a week. But the takeaway from this is if you could potentially get a synergistic approach using all 3 types of treatment. So that's kind of the conversation in my head is potentially if, let's say, I have a slot of 20 minutes for patients and I'm going to be doing the shockwave, I have radial, I have focused, I'll do both of those, and then if I have 4 to 7 minutes, I can add in the Remy as well. So that's kind of my thought. As I was talking to someone there, they were saying, well, Don, since you don't see a lot of arthritis, they're kind of saying that or I do see, midfoot arthritis and things like that, but they're saying that the EMTT is a little bit better for that. So I'm still unsure. I was thinking more about it last time, and I'm not sure right now. Sorry for anyone from Curomedics that is listening to this, but I'm just kind of saying what the impression was. I'm considering just adding a little bit of that Remy since I got that time with the patient, or even just talking to the staff. I was talking to one other doctor that uses the Remy and has it, and they have their staff do it. And which I liked about this conversation is they said, well, I have an acute and I have a chronic type of treatment package. So for an acute, let's say it's 4 to 6 treatments, and then the chronic might be 6 to 8 treatments, or I think she said 8 to 10 or 10 to 12, something like that. But anyway, so they're come in packages, and would be like I think $297 or $397, something like that. But the nice thing is these are all things that are done by the staff. So in their practice, they teach the staff where to put it, and then they do that Remy. And that's the nice thing about, I think, Remy or other types of lasers is you can have staff. I haven't really bought into it. I want to be frank. I'm kind of skeptical to say, do I need to really add this to the other 2 things that I'm doing for these conditions? But I think that's the same thing with anything. Do you really need to add an additional treatment? Like, is what we're working? I think the biggest problem with adding modalities like shockwave or anything like that is because is what I'm currently doing enough, right? Is what I'm currently doing going to be sufficient enough for the majority of my patients, and do I need to add anything? And I think that's the biggest drawback to anything new in your practice is what you're currently doing. Right? So if you're currently doing something and it seems to be working, why do you need to add it? And I think that's the big question when it comes down to it. So the way I'm treating plantar fasciitis now, was it working? Was I doing a good job before? And I think the best one that explained that, his name was Paul Hobro, and I really like Paul's approach. And I'm going to ask him if I can use his audio, because I did record his lecture, and I might include it into the podcast. But he had a great explanation of kind of there are a few questions that you ask patients, and for those of you that haven't downloaded my patient presentations tool, in there you're going to see these questions, and I might modify them based on what he said, but these are questions I specifically put in my presentation. So I'm going to stop and I'm going to ask patients. So I'm going to have them see and feel kind of what they're feeling, and and these are questions like, how long have you had the pain, and how does it affect your life, and things like that. These are important questions that I think many times we just speed on over. And this is something that he really made a approach in his talk, where he said, you have to ask these questions. You have to pretty much figure out the pain, and then kind of instigate that pain, and then you can go and solve that pain. If you're just telling them, it's so much different than if they tell you what's going on. Another thing that Paul said is he gave them options, and he does not push them. And he says, basically, you're going to have these 3 options. One option is through traditional treatment, where we don't do any of the shockwave or anything like that. The second type of treatment is with shockwave, and then the third one is with the EMTT. And the way he explains it is the traditional way is the regular treatment, educating people, things like that, which you're going to do anyway. The second treatment is radial and focused shockwave, and the supercharged approach is with the EMTT. And the way he does it, he does 6 treatments, and I think he charges $200 or something like that. I think he does a package, 6 treatments for like $2,000 or something like that. I think that's what he charges. So if you're doing, let's say, 300 treatment, that would be 6 treatments would be $1,800. We currently do 200 a treatment, and based on everyone's conversation there, we all could increase the price as long as you're sharing the value and as long as you believe in it does work for your patients. And so everyone pretty much charges cash for these things. These aren't covered by insurance. So I really liked that approach of saying, but what I really liked what he said is, he said, he presents the 3 options, and basically we can do the traditional approach, we can do the shockwave approach, or we can do the supercharged approach, which is better than anything, right? And then he goes and he says, we're going to start with the traditional approach. I'm going to explain everything for you, and then you can make a decision afterwards. This is what I really like about his presentation. So basically he says, if we do the shockwave, you're going to get better 50% faster, and there's an 80% success rate. That's how he says it, 50% better, 80% success rate. I really like that approach of explaining you're going to get better faster, and it's going to work better, and then you can decide after. So then you go through, and I may even switch the place where I talk about these 3 options, because in the past I used to talk about the options. You can do nothing or keep doing what you're currently doing. You can do conservative, or you can do surgical. But I like his approach with offering these 3 types. So when you look at the patient presentations tool, you might see that I'm going to change it. Okay, I might change it to traditional treatment, shockwave, or shockwave, or like advanced shockwave plus other regenerative modalities, type of thing like that. So that was my biggest takeaway today, is this idea of communicating these 3 options to patients and offering them to the patients, and then doing more of your presentation. So the conversation in my head is, well, I'm going to talk about these 3 ways of treating, then I'm going to continue to show my slides of explaining everything like that, and then I'm going to come back around and say, okay, Mrs. Jones, what type of treatment option do you want? And the other thing that Paul says, when you're answering like the phone or explaining, you can say, and this is very expensive. So actually, instead of hiding how much it costs, really be frank. And this is expensive. I'm the most expensive, and it's expensive because it works. And so I really like that idea. That was a good takeaway. A couple of the other good things I liked about listening to other people's marketing were the use of frequent email messages, about having like a weekly email that kind of puts content out there, whether it be in a newsletter fashion or some other type of fashion. This is very helpful for our patients as well, and kind of keeping front of mind for them. Kind of a conversation piece here or thought is, if Curamedics, as an added bonus, they could even have, instead of having just a doctor email, they could make one, and this is for you, Elise, if you're listening, they could make a patient-specific email list. So let me explain what that would be. It would basically, if for us, for example, foot and ankle, we would have a special autoresponder, foot and ankle, and when patients get shockwave, or people that are interested in shockwave or interested in getting information on shockwave for the foot and ankle, let's say they go to their website and they're getting information on shockwave for the foot and ankle, then it would add them to like a weekly email that even could be evergreen. Meaning it would be on plantar fasciitis, it would be on Achilles tendonitis, it would be on bone marrow edema, it would be some webinars, and these would be kind of pretty much repeating themselves and going on forever as an educational component for our patients. So those are kind of just the high points. It was a good social time. The food was okay. I liked it that a couple of the other doctors are also using. This is something that I kind of like. It's the intermittent fasting. So they're working with weight loss. There's something called Prolon. That's called a fasting mimicking diet. If you followed any stuff from Jason Fung, Fung, or any of these other ones, there's a fasting mimicking diet. And so if you order it as a doctor, I think it's about $100 for this fasting mimicking diet. It's a 5-day course of fasting with very, very low calorie stuff, and it's kind of as if you're fasting, and you get some teas and some other types of stuff like that. I think if you're going to fast, you might as well just fast. You don't need that, but it's another option, and it's something that doctors can buy and then they can resell to their patients if they're working with weight loss. Not that I work with weight loss, but I do talk to my patients about this because it can help their health. I was talking to another doctor as well about laser treatment for fungal toenails. I know I was at a shockwave course, but we're talking about other podiatry stuff. They said they had a way of explaining it where you can treat it from the inside out and the outside in using topicals and using laser and other stuff like that. I'm still not sure. If you guys are really passionate about this, send me an email. I'd like to know what other people's thoughts are. Don at Podiatry Practice Mastery. I'd like to know. I still have a hard time, and I've mentioned this before, like if the Lamisil is going to work, why add the laser to it? Because the laser by itself I don't find works as well at all, and that's why I'm not doing much laser. I do find the oral works well. But I guess if you would extrapolate that, why don't I just treat everyone with plantar fasciitis with cortisone injections, and why do I need the shockwave, right? If cortisone's working, why do I need other stuff? Well, and it didn't work for everyone, so I guess you could extrapolate that into the nail fungus treatment as well, right? So that was one thing that got me peaked. I was talking to this other doctor about AFO and orthotics, and just I want to throw it out here for those that are listening, because some people have been wondering, and I'd like to know your thoughts, those that are listening. But for posterior tibial tendon dysfunction, typically a Ritchie brace, but there is something called a Medial Blaze AFO by Insightful Products that I recommend much of the time if I'm bracing them. And then also I talked about for midfoot arthritis a meso brace, but I was talking to some of the doctors about using for arthritis the EMTT and also the shockwave to help them to feel better. Once again, it's not going to I want to be clear, it's not going to cure the midfoot arthritis, but the thought is, can you then with their midfoot arthritis make them feel much better and be able to be able to function at a better level? And that's the thing when we talk to people, it's the pain level. Let's say their pain level is a 6, but before they couldn't walk at all, and now they can do like 2 walks a day or something like that. And so they're doing much better, and this may be an option to avoid some midfoot fusions. So anyway, that are the thoughts from it. Please, if you haven't got my patient presentations tool, they are within that free download within podiatrypracticemastery.com. Also, the Practice Mastery Academy is there. If you want my 30-day practice blueprint, if you want actually all my PowerPoint slides that you can make your own patient presentation tool, and all the webinars, everything is right there within the Practice Mastery Academy. Right now, I think it's a single price. I'm wanting to switch it to a subscription model. For $97 a month, because that's eventually where I want to get to, is a $97 a month. I don't know where it's going to be at when you go there right now, but you can go look. You would get all the content that I have. But once again, I love this. I love helping you guys, and please send me an email, send me your thoughts. Okay, until next time. Thanks, guys. Have a good one.